Deputy Chairperson Patrick Mdletshe joins us now via Skype. Good afternoon to you and welcome. And let me put to you that over the years, it would seem that more and more people are gaining access to vitally important HIV/AIDS medication. Surely we can start saying at this point a corner is being turned?
Yes, indeed, Gary, but also we continue to have a lot of challenges. Looking at the healthcare system broadly, we are actually facing a situation where we're seeing more and more people coming into our health facilities asking for help, but at the very same time, we do not see that expansion in the side of the government to expand the services and in terms of the human resource. Those are the continuous challenges. You'll find people start queuing at the early morning, early hours at 4 a.m. moving forward. And then these are continuous challenges. If you remember at the president's statement when he said we need to gun for more and put more people on treatment in South Africa, at least 2 million more. By 2020, we as Treatment Action Campaign, we are supporting that call, but we also calling for more than if we cannot go for higher numbers and also not fixing the healthcare system that is supposed to be taking care of the very same people. So we are calling to the government to say, let's fix the healthcare system, let's make sure that we have enough staff, we have enough resources as well to make sure that we support such numbers. Other than that, we'll continue to see more people that are lost to follow up. We'll continue to see people that are dying while they are on treatment. But this is just one good thing that is happening in South Africa, but we need to strengthen our healthcare system in South Africa.
So let me take you back to the first part of your answer. When people come into clinics, often underfunded and under-resourced, as you say, where specifically is the assistance deficit? In other words, what sort of help are they looking for? What services are lacking in that respect?
For quite some time now, the serious investment, and if to be precise, maybe I'll say from 2013, we started to see the stagnation of the budget allocation to healthcare department, and later then we started seeing it declining. However, if you look at the numbers, others may argue to say health department has been receiving a lot of resources, but in actual sense of things, that is no, because if you look in provinces like Mpumalanga, the Eastern Cape, the Free State, Limpopo, in some part of KZN, we started seeing the high numbers of people coming to facilities but not getting the medication. So these are some of the challenges, and also you start to seeing lesser and lesser nurses in these facilities. So unless we fix these primary things, then probably then we can then say one day then our healthcare system is fit for purpose.
But what I'm failing to understand is we've just reported that healthcare in this country receives the third biggest allocation of the national budget. So it's not a question of the money not being available. Are you suggesting then that it is simply poor allocation and management of that financial resource, or is there more to it than that? Is there corruption within that value chain?
It's a mix of all what you've just mentioned. For me, when we talk about the budget allocation, it's actually declining, because you remember most of the facilities that were lately built, but we're still crying for more facilities that to be built, meaning we're going to continue seeing more people coming into facilities or flooding the facilities, because these facilities were not built for the kind of capacity that they're currently running on. But other issues are the issues of mismanagement of resources, legal resources that are there. For me, they are not enough, because if they were enough, we would have each and every facility have sufficient staff in each and every facility, which that is not true. We will always find maybe a facility of supposed to be having about 20 nurses. It's run by 10 or 8. So in terms of the nurse and the patient ratio, you always find that there is more at the public facility compared to private. That is one of the reasons why you see this migration of nurses from public to private. But beyond that, also the element of corruption is something that we cannot shy away from. It also direct rob us it directly robs us all in terms of getting where the resources are supposed to be. And sometimes it's so embedded in our system that it's even hard to detect, even for us as civil society.
Mr. Mdletshe, I'm going to interrupt you because time is against us, and I want to ask you one more question. And again, you'll correct me if I've misread this, but there was a statement that was put out by the Treatment Action Campaign not too long ago saying that you were concerned about the appointment of David Mabuza as the Deputy President of this country and its impact on the fight against HIV. What did you mean by that?
We will all remember Ubabu David Mabuza couldn't run his own provincial AIDS council in the province. It took the Treatment Action Campaign and the NAPO and many other partners to bring him on board after we picketed for him when the Deputy President Mdletshe came into Mpumalanga in 2014 for him to chair. But other than that, the AIDS councils, even up until today, the AIDS councils in Mpumalanga are not well run as they're supposed to be. Remember, the response to HIV is more of a political leadership than any other thing that you need, which create a conducive environment then for the mayors at the district level and also for the mayors at the local level then to provide such leaders. But if then the leader at the provincial level is not providing such, then you're not going to have that a strong provincial AIDS council. That means you're not taking HIV seriously. So then we were really concerned for him being a chairperson of SANEC. However, that is a space as Treatment Action Campaign that we're working within, but then we will continue to engage him and then we'll take him to task to ensure that he's actually doing what he's supposed to be doing.
Thank you very much for talking to us. Treatment Action Campaign's Patrick Mdletshe on the line to Newsday from the Free State.